ma'am. Bismillahirrahmanirrahim. Research is to see what everyone else has seen and to think what nobody else has thought. My topic of presentation is scenario-based discussion on study designs under supervision of Professor Saira Afzal. Learning outline. In this presentation, we are going to discuss different study design scenarios, which will include descriptive study designs, analytical study designs, experimental study designs, and qualitative study designs. And at the end of the presentations, participants will be able to describe different study designs. Scenario number 1. A 69-year-old patient who has been hospitalized twice because of bacterial pneumonia. 3 weeks prior to admission, the patient had suffered fever, dry cough, 0.5 to 1 centimeter nodular lesion on dorsum of tongue, as a result of which he was unable to eat. 2 acid-fast bacilli smears were positive. Tuberculosis testing, X-ray, and histology confirmed the diagnosis. Tuberculosis treatment was started, and after 2 months, the nodules disappeared. The physician has written details about the patient. Which study design is this? Anyone from the class? This is
Please
a
answer.
case.
No. Please answer it. Please go back to your previous slide, Behri.
Okay, ma'am.
Right. Please answer it. Dr. Isma, please answer it. Dr. Isma, please unmute yourself and answer it. Isma, you don't know? Dr. West, please unmute yourself and answer it. Dr. Amber, please unmute yourself and answer it. Dr. Amber. Dr. Amber Arshad. Dr. Sadia Rafiq, would you please answer it?
Yes, ma'am. Sure. The reason is this, ma'am. There's a single patient, and the physician is writing about the details of the patient, so it's the case report.
Thank you very much. Very nice. Next, please.
Yes, the correct answer is case report. As you can see, the key points are that it is a single case and there is a rare finding, although tuberculosis is common, but as a result of which nodular lesion is not explained by the previous knowledge, and detailed history, management, and outcome of a single case is written by the physician. So it's a case report. In case report, anything rare in symptoms, history, examination, management, outcome, anything unusual can be written. Scenario number 2. In 1980 to 1981, 4 previously healthy young men were diagnosed with pneumocystis carinii pneumonia, which is an unusual infection that only is seen in immunocompromised people. The medical histories didn't suggest any pre-existing immunodeficiency, but all 4 men had decreased immune responses and lower T cell counts. These unusual infections suggested the possibility of previously unknown disease. It was noted that all 4 men were homosexuals, and the findings were published in New England Journal of Medicine. This is an example of. Anyone from the class?
Please. Case series.
Yes, the correct answer is case series, because it's a rare disease in in all the four men, and it was noted that all of them were homosexuals, and more than one individual is reported in case series with similar cases. Case series is that when several unusual cases with similar conditions are described in a published report. In case series, there are cases, and it differs from the case control study design the fact that there is no control group in case series, and there is usually a small number of participants or individuals, but the cases can be large, as there are some case series which have even reported more than 1,000 patients. Scenario number 3. A researcher wants to determine the prevalence of obesity in a community and its associated factors. For this purpose, he went to the community, measured BMI, and asked about eating habits and physical activity. What is the most appropriate study design?
Cross-sectional study design.
Yes, the correct answer is cross-sectional study design, because cross-sectional study design are also known as prevalence studies. They determine the burden of disease in the community. And the other point was that both exposure and outcome were determined simultaneously in this scenario, because he measured BMI and asked about eating habits and physical activity at the same time. So it's a cross-sectional study. Scenario number 4. A researcher wants to compare height and weight of school-going girls and boys. He gathered data from the schools at a single point in time and found that height of boys and girls was not statistically different. What is the most appropriate study design? The researcher is comparing height and weight of girls and boys, school-going girls and boys.
Comparative
Meha?
cross-sectional.
Yes, it's a comparative or analytical cross-sectional, because a researcher is comparing prevalence of two groups at a single time, and analysis between the two groups is done. In comparative cross-sectional, different groups are compared at the same time. Scenario number 5. In a study done in Pakistan, an association was found between sale of tobacco and increased deaths due to asthma. This is an example of
Dr. Meha would answer it. Dr. Meha, please unmute yourself. Yes, what is the answer? There is an association. So what are the studies that are used for association?
Analytical.
Right, there are further types of analytical studies. Which type of analytical study is this one?
Case control.
Why case control?
Because we have to find association between two groups. We have to find association between that sale of tobacco and increase in death. So we will make two groups, cases and controls, to look for the association in the end.
Once, what is the outcome? Death due to asthma. Once the person has died of, how would you ask him about the tobacco sales? As you know, the case control study is a retrospective study. You have to go into the past. So once there is a death, how would you ask about the death of a person, and how you would relate it with the sale of the tobacco? A person who is asthmatic and later on he died of due to the chronic asthma or status asthmaticus. how would he or anybody can give the history of sale of tobacco? Dr. Meha, I'm asking from you, please.
Yes, ma'am. So we'll do cohort study because we'll go prospectively.
You want to do it in the form of a cohort study, and you want to follow that person prospectively. Okay, right.
Yes.
Okay, Dr. Mehin, please continue.
Ma'am, the correct answer is ecological study because an association was found between sale of tobacco, which is a group level data, and we have to generalize it to deaths due to asthma. We generalized it to individuals. So the correct answer is ecological study design. In ecological study design, we take group data and associate it with individuals with an outcome. And
Dr.
the drawback of this.
Dr. Mehin, let us discuss it further because we all are postgraduate students and we know it that this can also be done in a prospective manner, as Dr. Meha has mentioned. Why not a cohort study? Let's discuss it further. Why not a
Uh,
cohort study?
Ma'am, because in this
Uh,
scenario, we did not know about the individual exposure. We had just taken data from tobacco sale, which was collected from any other purpose. So secondary data is being used, and we have found association with individuals.
In ecological study, we have the group data and we have those parameters that are present in a certain community, right? But this can also be followed prospectively in a cohort. For example, as we all know that in Chernobyl, there was an atomic accident that led to the whole community to have atomic exposures, etc. Right? So in that, we can conduct the ecological study. However, there are so many people that are involved in certain important parameters, like for example, from water pollution, from air pollution, from the sale of tobacco, from the sale of high sugary drinks, soft drinks, etc. It can be done prospectively. So I think that it can also be a cohort study, and even it can be done in the way, because in cohort we need a control group. The control group would be those where there is no tobacco sale at all at places. It can act as a control, and where there is a tobacco sale, that would be the cohort. And where there would be the more cohort of having tobacco sales, they would be having more deaths due to chronic COPD rather than asthma. So for having it is very difficult to know more about the sales of tobacco and its relation with asthma. However, yes, there is an association that can be checked. However, if it is COPD, we all know that the biological plausibility is more with this scenario. So I think this scenario is rather incomplete. It should have more information about certain things in order to label it as ecological trial or ecological study.
Okay, ma'am.
We don't know about the place where it has been taken place, what is the setting, what has been done. As I have told you that the classical ecological study is of Chernobyl, and if you study that, it is a typical example of an ecological study. But this is not a typical example of an ecological study. So it can be a cohort study too. So I
Okay.
totally agree with Dr. Meha.
Next
Okay.
scenario, an investigator takes a sample of healthy individuals, record their ongoing solar exposure, and relate to subsequent occurrence of skin cancer in the same group. What is the most appropriate study design?
Anybody from the class?
Cohort study design.
Cohort study.
Yes, the
Very
correct
right,
answer.
very right. Yes. Why cohort study? Dr. Wes, why cohort study?
Madam, because in cohort study, We divide the groups into exposed and those who are not exposed, and then we study for a period of time those who are exposed and the disease outcome, and we also study the those who are not exposed and that whether they conduct the disease or not.
So we have the exposure, and we want to know the exposure has some association with the skin cancer or the outcome, and there is a follow-up too. So this is a cohort study. Very nice. Thank you very much. Next, please.
In cohort study, as already discussed, we divide it into exposed and non-exposed, and we follow it for the outcome. Next scenario. A researcher wants to begin study on association between smoking and lung cancer. He collected smoking habits from college roster in 1999. Using this data in 2020, the researcher determined who has developed lung cancer or not. This is an example of
Anybody from the
Case
class?
control.
Very nice, Meha. Meha ne kaha? Right.
Yes, ma'am.
Yes. Please explain, Karo, why it is a case control study.
Ma'am, because exposure has been occurred and the researcher is going back to look between to look for the association between smoking and lung cancer.
Very nice. So the best study design that can explain this question, that how the smoking is associated with lung cancer, the best study design would be the
Case control.
case control study. Very nice, Meha. Okay. Next, please.
Ma'am, it can also be a retrospective cohort study as a researcher has collected smoking habits from college roster in 1999. He has collected the exposure from the past, and in 2020, the researcher determined who has developed lung cancer or not. So it can be a retrospective cohort study. In retrospective
Okay. If you
cohort
go to
study,
your question number 7, please.
after the onset of study, the researcher determines the outcome.
In question number 7, you already have given the outcome. A researcher wants to begin a study on association between smoking and lung cancer, right? He collected smoking habits from a college roster of 1999. Using this data in 2020, the researcher determined who has developed lung cancer or not. This is an example of in 2021, as the whole of this has occurred, even those who have developed lung cancer, they have occurred because we are in 2021. So it can be a case control study, and I agree it can be a retrospective cohort study. However, if you give us any clue that the person want to follow it in forward direction, then it can only be a retrospective cohort study. As the outcome has occurred, so it can be a case control study. So I again agree with Dr. Meha. Her answer is correct if she said that it is a case control study, because the lung cancer has occurred in some of the people, and some of those who are smokers, they have not developed lung cancer. And we know that it is there is always a possibility that those who are smokers, they may not develop lung cancer. So this question can have two answers.
Okay, ma'am. Scenario number 8, a researcher wants to estimate the risk of bronchial cancer with smoking. 200 bronchial cancer patients and 400 pancreatic cancer patients were enrolled to assess risk of smoking and bronchial cancer. Results showed that 80% of bronchial cancer patients and 25% of pancreatic cancer patients are smokers. Which study design is this?
Anybody from the
Prospective
class?
cohort study.
Dr. Mehin, would you please like to go forward?
Yes, the correct answer is case control study, because in this scenario, we can see that the outcome has already occurred, which are the bronchial cancer patients and pancreatic cancer patients. And we go back in direction to from history to determine if exposure has occurred or not. In
Dr.
case
Mehri, right. Actually, It can also be answered in the form of a retrospective cohort study. So your scenario, it is not giving us any clue that it is only a case control study. It can be done in having all the data that has been recorded, and we followed it prospectively till the patients having bronchial cancer or pancreatic cancer have developed. Moreover, why you have joined two cancers in a same question? Why not only one cancer and looking back at the risk factors? In case control study, usually we have the outcome, and that outcome is a single outcome, and we go back and want to look at various risk factors. So risk factors may be more than one, but the outcome is usually one. It is not a hard and fast rule, but the typical case control study has a single outcome and it has many risk factors. However, in cohort study, there are multiple outcomes that can occur.
Yes, ma'am.
Dr. Mehreen, how would you explain this?
Ma'am, in this scenario, there were 200 bronchial cancer patients, which were the cases, and as a controls, 400, which is 1:2, 400 pancreatic patients were the controls in this scenario.
Okay, go further, please. Actually, again, I would say that this scenario can be answered. If I am the examiner, I would like to place it into retrospective cohort study, because there are more than one outcome that has occurred, and you have taken the exposure to the smoking, and in the forward direction, some of them would develop the lung cancer, and some of them would develop the pancreatic cancer, and perhaps some would develop both the lung cancer as well as pancreatic cancer. So it can be done as a retrospective cohort study. Right. So please go forward, please.
Okay, ma'am. Scenario number 9, a researcher wants to study undernutrition in school-going children in a community. For this purpose, he selects 2,194 school-going children. 5 children developed malnutrition at the end of the first year. Individually matched controls were selected from the group of school-going children, which is the most appropriate study design.
Please, Dr. Mehreen, complete your presentation. We have a lot of discussion now. Please go
Okay, ma'am.
forward.
It's a nested case control study, because in nested case control study, we start with a cohort, which is a group of individuals, which is school-going children in this case. And from this, 5 cases were developed at the end of first year, and individually matched controls were selected. So this is a diagram of nested case control study. We start with the cohort. When a case develops, we select the individually matched control. And if we take controls at the end of the study, and controls are group matched rather than individual matched, then case cohort study is the appropriate study design. Scenario number 10, a researcher wants to test new anti-malarial drug. For this purpose, he selects confirmed malaria cases from hospital. Computer-generated numbers were used to randomize them. New drug is given to patients, while others half received standardized treatment, and follow-up is done after 1 week. This is an example of This is a randomized controlled trial, because cases are selected from the hospital and intervention is being done, and a computer generated number is a method for randomization. Other methods are a lottery method, and follow-up is done after 1 week. And if randomization is not done, then it can be non-randomized controlled trial. Scenario number 11, a researcher wants to assess the use of antibiotics, amoxicillin and cephalosporin for treating childhood pneumonia. For this purpose, he randomly allocated participants in group A, amoxicillin, and group B, cephalosporin for 3 days. And then after 2 days a break, he gives group A cephalosporin and group B amoxicillin for 3 days. The outcome is measured. This is an example of, it's a crossover study design, because after random allocation intervention is given, and then there is a washout period, and then the opposite intervention is done afterwards. Intervention done such that the group receives the opposite intervention. So this is a crossover design. Subjects are enrolled, randomization is done. Group A and Group B are given intervention, and then there's a washout period, and after that the opposite intervention is received and outcome is evaluated. A researcher summarized the symptoms, signs, lab diagnosis, treatment, and prognosis of patients through literature search of articles of COVID-19. This is an example of, it is a narrative review or literature review, because the researchers has summarized the signs, symptoms, lab diagnosis, and treatment and prognosis of patient, and high level summary of what has been done is generated in narrative review or literature review. And there is no set criteria for choosing the articles, and it is a study of the studies, and it helps to identify gaps where more research is to be done. Scenario number 13, a researcher wants to determine the benefits of use of ivermectin in COVID-19 patients. He searched databases and selected studies which meet the inclusion criteria. Information is gathered and combined to generate evidence. This is an example of a systematic review. In systematic review, there is a well-defined research question, which is benefits of use of ivermectin in COVID-19 patient. And after that, literature search is done. We screen the study, extract data, and combine and generate evidence. A systematic review is a review of clearly formulated question that uses systematic and reproducible methods to identify, select, and critically appraise all relevant research, and to collect and analyze data from studies that are included in the review. Scenario number 14. A researcher wants to assess odds of smokers among cancer patients. After selecting studies through literature search which meet the inclusion criteria, combined odds ratio is calculated. This is an example of, so this is a meta-analysis. It is again a study of studies, and researcher has selected studies with the outcome of interest, and the outcomes are gathered, and pool analysis is done, as a result of which we graphically represent the study, which is also known as forest plot. Scenario number 15, a researcher wants to know about the typhoid vaccination drive in children of Lahore. Data is collected through in-depth interviews, group discussions, media, and newspaper from January to June 2019. In-depth report is written. This is an example of, it's a qualitative research. The most appropriate will be case study, because in case study, we can know about any process, a group of individuals, or a single person, and it is bounded by time and place, and multiple data sources are used for collecting the in-depth interview. Scenario number 16, a researcher wants to find out factors responsible for early marriages in rural areas of Lahore. Data is collected through in-depth interviews and group discussion with rural communities, as a result of which factors are generated which are responsible for early marriages in rural areas. This is an example of, again, this is a qualitative study design, grounded theory. In this, we study the process, and multiple sources of data are collected, but this is different from case study, because factors responsible for early marriages in rural areas of Lahore, a theory is generated as a result of the grounded theory. A study was done by the researcher to know about the culture and traditions of females living in rural community, which has infant mortality rate higher than the country's average. The researcher went to the community and observed the practices of female. The best study design is, again, this is a qualitative study. The most appropriate study design will be ethnography, because females living in rural community, that was the research question, and the researcher goes in that community and lives there to observe. Observations are taken in ethnography, to observe the value, tradition, beliefs, culture which are responsible. This is the last scenario. In an air crash accident which occurred in Karachi, Pakistan in 2018, there were 2 survivors from the air crash. A researcher wants to know about the experience of survivors during the air crash. The appropriate study design is, this is also a qualitative study, phenomenology, because in phenomenology, it's about the essence of human experience, the humans which have shared a rare experience or a certain experience. We write about them, about the experience during the event. These are the references of my book, and thank you.